Officials in California have declared an emergency over the rapid spread of bird flu in livestock. The first case of severe bird flu in a person has also now been confirmed in the state of Louisiana. The H5N1 virus is widespread in wild birds and can easily spread to commercial poultry and cattle. It has been detected in hundreds of dairy cattle herds this year and also in dozens of people nationwide. Health officials say it's generally only a concern for animals and that most of those who had been infected had mild cases. But for more on this, I'm very pleased to welcome Lena Sun, a health reporter with the Washington Post, who can help us dig in here a little more. The United States has confirmed more than 60 human cases of bird flu since April. What sets the case in Louisiana apart?
It's the first time that the United States has confirmed a severe case of illness. In all the other cases, people have not gotten that sick. This person is over 65, is in critical condition in the hospital, and has medical conditions, underlying medical conditions that puts them at greater risk for complications. And so they had a briefing this week. Unfortunately, we don't have a lot of details about what else is going on with this person for privacy reasons, but they do have severe respiratory symptoms related to the influenza illness.
Now, the bird flu virus has also been spreading in dairy cows, the epicenter, of course, California, which has declared an emergency. How severe would you say the situation there is?
Well, California is the largest milk-producing state in the country. So over 600 dairy herds have been infected in California out of the total of more than 800 in the entire country. So statistically speaking, it is a lot, but it is what you would expect in the state of California. The governor declared a state of emergency this time because it's spreading beyond the Central Valley to Southern California. The state having a state of emergency allows them to coordinate responses more and resources more, but it is definitely a serious concern. And last week, 2 cats in Los Angeles who drank raw milk that had been recalled by a company because H5N1 avian influenza virus had been found in the milk died.
Wow.
So this is of concern, but that's raw milk that is pasteurized because it's heated for a certain amount of time at the right temperatures, inactivates the virus. And that is why health officials, ever since the beginning of this outbreak was first announced in the spring, have urged consumers not to drink raw milk. Raw milk also has a ton of other bad pathogens and bacteria.
The concern here, though, must be that an uncontrolled spread that you might see in dairy cattle could then heighten the risk of more spillover into humans. Is there anything that can be done to prevent that from happening, to prevent it from spreading?
Yeah, well, some things are already underway. The USDA finally has started a national milk testing program to find the virus before it goes to pasteurization. That way, it gives you a sense of where in the country the virus is moving. And because many people think now that the testing is not enough in milk or in animals. For humans, the folks most at risk are the workers who have interaction with cows and with poultry. 61 human cases have been confirmed in the United States. All but like 1 or 2 were in farm workers. And for those workers, they need to, the CDC has recommended that they wear the proper protection, which is stuff for your eyes, gloves, because the way the virus gets into you is like a splash of milk into your eyes, your nose, your mouth, and the virus can get into the body that way to increase that protection. And also, they are urging those farm workers to also get the seasonal flu shot. Seasonal flu is different from the bird flu. But if you're a farm worker and you get seasonal flu, then on top of that, you get bird flu. The 2 viruses in the same person could combine, swap genes to make another virus that is more lethal and more easily spreadable person to person.
Okay, huge risks to be had there. Thank you so much for sharing your insights with us. That's Lena Sun, a health reporter with the Washington Post.
Thank you.
Let's get more with Peter Chin Hong. He is an infectious disease specialist at the University of California, San Francisco. Welcome to DW, Peter. I want to start by asking you about what stands out about this case in Louisiana, given that there have been dozens of cases in the US already.
I think what stands out, Namisha, is that this patient was seriously ill, first of all. Most of the other cases, as you mentioned, were very mild. So it represents a mutation. The second is that this is the first time somebody has been exposed to backyard flocks, like chickens in the backyard, where the animals were dead or sick. So it represents an emerging risk to the public in general. And the third reason is that, it's really part of, more humans getting ill, and represents also crossover from birds into more and more mammals.
And while this case was in Louisiana, it seems there is serious concern in California, which has declared a state of an emergency. Why is that?
Well, it's a way to be proactive, just like we had a state of emergency in COVID, and more recently before this in Mpox, formerly known as monkeypox. It's a way to divert resources, to have more hands on deck, to have agencies talk to each other in an efficient way, and to have healthcare workers and public health workers be more flexible. So that's really a proactive move. But we are in a precarious position where we're in this in-between space between a lot of animals getting ill and humans starting to get sicker.
Right. You mentioned in the beginning that the Louisiana case could represent a possible mutation. So what can be done at this point to prevent the H5N1 virus from spreading further amongst humans?
Well, the challenges of H5N1 is that unlike COVID, which mainly affected humans, you're talking about animals. And because of that, you're talking about industry, agriculture, people's daily lives in terms of buying eggs, for example. I think that is why it's complex. And we're in a very different place from COVID, however. Unlike COVID, we have 4 drugs, we have vaccine candidates, we have a diagnostic test. But like everything, the devil is in the details, and we have to connect the dots. So that's kind of where we are right now in this kind of really purgatory or precarious position.
It's interesting how COVID has become the benchmark for when we should start getting really concerned. But I do have to ask you, is there a lot of risk to the public at this point, or is it also dangerous to be dismissive just because this disease is mainly affecting animals?
I think we have to have that balance between panic, which I don't want anyone to have in the public, and vigilance. So I think we need to be watchful. And the reason why is that there is still risk to the average person drinking raw milk, which is getting riskier and riskier, even giving raw milk to cats at home, which are also very infected. Number 2, handling dead birds, sick birds, animals. And 3, I do continue to worry about dairy workers and poultry workers. Whether or not they need to be vaccinated like they've done in Finland is a topic of conversation right now in the United States, because again, we have some vaccines, but probably enough for just 2% of the population.
Dr. Peter Chin Hong, thank you so much for walking us through that.
Thanks so much, Namisha.